there's much more risk for those individuals who have the least. They become the most vulnerable. And what the role of the public health department really is to make sure that there's a good safety net.
The majority of our clients are actually come from impoverished communities. Over 80% of our clients live at poverty level or less.
Some of the families that we see face things that would be scary for anyone. And then if you have, on top of that, the inability to get the resource you need for your child, it's terrifying.
1 out of every 3 people living in this county have no health insurance. And the majority of those people are employed. But insurance is so expensive they can't get it. Their employers can't buy it for them.
One of the big things, of course, is especially for people that don't have a lot of resources, we have to make sure that they have access to health care. Once they have access, the access has to be to quality health care. And that is critical, because if you get there and you're ignored, you're not treated well, you're not respected, it doesn't really do you much good. And then it's cost. People do need to have a way to be able to pay for whatever service they're getting as well.
Young and Healthy is a community project that provides free health care to low-income, uninsured and underinsured kids in the community. We're able to provide this care for free to kids because we have a cadre of about 300 professional volunteer doctors.
The Brzee Foundation had the vision to build a youth center here in the South Hollywood area. Jeff Carr wanted to have a clinic embedded in the youth center so that children and families could be served here at the clinic, both from the medical perspective as well as from the youth and family needs perspective.
We were actually birthed in the basement of All Saints Church. 25 years ago this year, we started as an answering machine under the stairwell in the basement. And there was a small group of parishioners who knew that something had to be done. They decided to create a phone number and an answering machine that people could call in and start asking questions of where they needed help, things like that. And that was the start of what became Aid Service Center today.
Pasadena has to be unique in having so many churches that are so concerned in a way that it goes beyond just trying to bring people to their church. And it's really been impressive for me coming from outside the city into the city to really see all of the things that are being done to try and really reach people and to help people.
There are many examples in the Bible of where Jesus himself embraced what society didn't. There's an estimated 60,000 people living with HIV and AIDS in Los Angeles County. The projection is that 30% of those people do not know that they have HIV. One thing that I would hope that we would be able to accomplish is that we could have a more open dialogue around HIV and AIDS.
The churches have been open to bringing in programs that do things like HIV testing. I've had some of the pastors that have actually, in the past, been tested in front of their congregation. This is especially important in the African American community, where now we are having reports just in the LA Times that, in fact, black women in the United States, in some cities, actually have higher rates of HIV than in some parts of sub-Saharan Africa. Staggering statistic inside the United States. How do you reach that population? Church. Church is the one intersection between that population and the public health world.
We try to have as many partners as we can because there's strength in numbers, and we can make our services go further if a lot of people are helping. Years ago, there was a little guy who was homeless, and he was getting services through a church preschool. He was in the preschool there, and he was on a scholarship. And the preschool director called us to say this little guy was 4, and he couldn't speak. We sent him off to an ear, nose, throat doctor, and that doctor discovered this little guy was literally tongue-tied. This little piece of tissue, right under there, was too tight, and it literally stopped his tongue from moving. So it's something you need surgery on. It is a very simple surgery. The surgery takes a minute, but you still have to have anesthesia and all the things that are involved. Huntington Hospital donated the surgery, the anesthesiologist donated his time, and snip, and we got that surgery done. I called to do a follow-up, and by this time the family had been moved into a motel, and a little boy answered the phone and said, "Mom, phone," and it was this little kid, Jamal. And 2 weeks before, he couldn't speak at all. As you start to talk to individual churches, there's lots of things that somebody might have an expertise in that maybe could help us with something. And we don't always know that till we have the conversation.
Without those resources, we cannot do what we value most. That is our mission, which is to serve the underserved.
Many of our families, their top needs have nothing to do with being HIV positive. We have to solve those issues before we get to the actual health issue or mental or emotional issues that HIV brings.
We have an obligation as the church, in my opinion, to make sure that people's physical needs are met, if you're a church, not just the spiritual side. So if the church is aware of the services that the city provides, the county provides, and can refer people into those services, that's a big thing that you can do that doesn't cost the church a lot of money, something that can be done at any time the church has a gathering.
The more we talk to each other and the more we expose each other to the work that we're working in, whatever that is, the more likely I think it is that we can make changes.